This is an exciting time. The long wait is nearly over and you are ready to deliver. How wonderful! As you wait for the special time of delivery, you will be watched closely and you will have a monitor attached to your belly to keep track of your baby's movements. This is called fetal monitoring and helps us know how baby is doing. The plan is to have a natural delivery, but sometimes a cesarean or C-section may be needed. A C-section is surgery. That means you will have an operation to remove your baby, and then you will have to recover from the surgery both in the hospital and when you get home. There are many reasons why you may need a C-section. These are the more common reasons. If you have had a C-section before, then you will probably need C-section again. You may have normal contractions, but your baby is unable to pass either because of size or abnormal position. Doctors have a fancy word for this called dystocia. If your baby is not moving normally or often enough, then your doctor will need to measure the heart rate of the baby before delivery. If there is concern that your baby is not tolerating your contractions, then you may need C-section right away. Finally, there can be a problem with the direction that the baby is facing during delivery. The normal position of the baby is head first and facing towards your back. If the baby is in a different position, such as feet first or buttocks first, then your doctor can try and change the position of your baby. But he can't wait too long. If your baby gets stuck in a position that prevents normal delivery, then your doctor will need to consider C-section. Remember, C-section is a surgery, and every surgery has risks, such as bleeding, infection, and development of blood clots. But C-sections do lower the risk of trauma to your baby, and your doctor must decide what is good for both mum and baby at the time of delivery. As with other surgeries, you may have the following ordered as part of your procedure. Anesthesia. A catheter in your bladder to reduce the chances of infection. Antibiotics to reduce the chances of infection. Compression on your legs to prevent blood clots. Intravenous or IV fluids. No food for at least 8 hours if your C-section has been scheduled. For any type of surgery, there is a risk for complications. Some of the complications are related to bleeding and damage to your bladder. During the time of your surgery, there is a small chance that you can have uncontrolled bleeding from your uterus. If the bleeding cannot be controlled and puts you at risk, then you may need to have a hysterectomy. That means surgery to remove your uterus or womb. This is done in severe cases of bleeding. Another possible complication of C-section surgery is damage to your bladder that must be repaired at the time of C-section. There are so many changes that you will experience after delivery. It can be quite overwhelming. After C-section, the doctors and nurses have some work to do before you go home. You may be given intravenous fluids to replace the fluid that you lose during delivery. Your blood count will be followed to make sure you are not bleeding. The catheter in your bladder will be removed. You can start eating soon. When you have a C-section, then you will have pain. Your pain may become much worse after the anaesthesia wears off. You can also have severe gas pain that can be sharp or crampy. You can have pain medication, but keep in mind that narcotic pain medications can cause nausea and constipation. If you plan on breastfeeding, then you can start as soon as you are told by your nurses. Remember, after delivery you will produce only a small amount of milk, called colostrum, that can be yellow and creamy. This is very important, since it is filled with nutrients and proteins that help protect your baby from infection. Then in 3 to 5 days, you will start to see more milk that has nutrients and much more water. Once you go home, it will be important for you to keep track of your surgical wound. You should call your doctor right away if your surgical site is very painful, red, or has pus or discharge. You should also call your doctor if you develop fever or have continued bleeding. Finally, if you have had a C-section, make sure that you go to your follow-up appointment with your doctor. Go Mummy!